the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back into Good Morning Arkansas. Talking blood pressure today with Baptist Health cardiologist Dr. Scott Davis. Dr. Davis, good morning. As always, thanks for being here and talking about new research, because I know you guys stay on top of that at Baptist Health all the time. And this is something that I think is pretty interesting, because this is involving blood pressure, and this is the staple. You walk into any doctor's office for any type of visit. I know in heart surgery and heart checkups this is ultra important, but new research coming out about the type of measurements that we're taking for blood pressure. What are some of the findings?
So when we do a risk evaluation for any individual, we want to look at blood pressure, at cholesterol, at smoking risk, at genetics. But the thing about the blood pressure piece is it's usually just one number that's grabbed in the office. Okay. And what was done now formally was a group of cardiologists in Europe then looked at the role of an ambulatory assessment. So having a blood pressure cuff on your arm, wearing the little measurement doodad on your belt, and then it checks it about every 30 minutes, and then gives me a 24-hour blood pressure assessment. Is, as you would intuitively think, is a much better way of doing it. And so what it underscores is this whole notion that we try to emphasize to patients, and that is owning your blood pressure, right? We want folks to not just rely on that one number that you get in the doctor's office, because it could be affected by white coat syndrome, where you get nervous because the doctor's here, and all of a sudden right before I blow up the cuff, your blood pressure creeps up. Or you may have what's called masked hypertension. In other words, you happen to be on the low side of your blood pressure right when the nurse grabs it out of the office. And so what this speaks to is that, look, if you've got high blood pressure, if you've got a family history of heart disease or blood pressure issues, we want you to own it, and that we want you to have a blood pressure cuff. Now there are more and more, automated blood pressure cuffs that you can get at any local Walgreens, Walmart, wherever.
They're readily available.
Right. And so what this tells us is we encourage people to start owning their blood pressure. Look, it's so hard to treat. Why? Because I typically don't walk around going, my blood pressure is 160 and I feel kind of funny. Now, some people have headaches, right? Some people feel flushed. Some people feel funny when their blood pressure gets up to a certain level. But as a rule, it is called a silent problem, because it is silent. Now, this is more data to say, look, the better that we can do for the individual to kind of own their blood pressure, take responsibility for their blood pressure, and then give meaningful feedback then to the doctor when they come back, it's much more valuable, like I said, than just grabbing a random number out of the air.
So better than maybe a professional doing it once a year, having this consistent type of check?
Absolutely. And I tell patients this all the time. Before we start making a bunch of wholesale changes based on one number in the office, oftentimes I'll tell folks, look, I want a log of your blood pressure over the next 3 to 4 weeks.
Okay.
So, keep your blood pressure, and then either, send it back to us or fax it or email it or however. And then based on those readings, we can say, oh yeah, you know what? That 160 we grabbed in the office, that's where you've been trending. Versus, you know what? We got a 160 in the office, but you didn't take your medicines that morning, and now that we've looked at your log, you're living in the 120s and 130s, and we don't need to change anything. So more information, more data, always better.
And, this is something, too, that's happened after those blood pressure modifications were made in terms of the range of score. Those changed earlier, I thought maybe late last year.
That's correct.
Where those changed to where it put more people at a risk for hypertension, because it said, no, it actually needs to be lower than 130, right?
And this is true. And the key thing to understand is, I tell people this every day, having high blood pressure one day, 1 week, 1 month is no big deal.
Okay.
It's month after month, year after year. So the sooner that we can get on top of it, we're just redirecting a battleship. But the end point over the next 15, 20 plus years can be very dramatic.
What about age, different variables in there? How does that going to affect your score?
Certainly, if you're prone to having high blood pressure early in your life, then that's going to have a more detrimental impact, decades down the line, right? Because it is an additive thing. But then we don't want to ignore the 65-plus-year-old subset either, and just say, oh well, you're too old to worry about it. So again, this underscores getting a blood pressure cuff at the house, keeping up with what your blood pressure is, so that you can give some meaningful feedback to your primary care doctor, cardiologist, whoever's assessing you.
Okay, constantly evolving in the medical world.
That's
New
right.
research all the time, whether it be from Europe or right here at home. It certainly helps us moving forward and helps you guys over at Baptist Health. Thank you so much, Dr. Davis, for coming in. Always great to see you. If you would like to find out more about your blood pressure, maybe find out more about how to get regular checkups to make sure you are heart healthy or just healthy overall, you can always contact Baptist Health at the information on your screen. They will help you keep on amazing.